Hello everyone, our next topic is cellulitis. So first moving on to its definition, which says cellulitis is a spreading inflammation. Okay, there is inflammation which is spreading in the subcutaneous layer, and this inflammation is caused by hemolytic streptococcus. So its proper definition is cellulitis is a spreading subcutaneous inflammation which is caused by hemolytic streptococcus. So next, moving on to the pathogenesis of cellulitis. Here the hemolytic streptococci will produce hyaluronidase and streptokinase. These are the enzymes. Because of hemolytic streptococci, there is infection. Infection will result in inflammation. Because of inflammation, there is production of inflammatory exudate. So here the hemolytic streptococci produced this two enzyme. This will result in spreading of this inflammatory exudate in the subcutaneous layer and in the facial planes. Ultimately, there is gross swelling in the affected part. Next is source of infection, means how does the hemolytic streptococcus enter into the body. It occurs because of injuries, either minor or major, graze or a scratch. Because of snake bite or scorpion bite, this hemolytic streptococcus will enter into the body. Next is the precipitating factors. It commonly occurs in the diabetic patients and in patients with low resistance, means low immunity power, which cannot fight back to the infection. In those people, these are very common. Common sites where and all it can occur. So wherever there is loose subcutaneous tissue like in the scrotum, or wherever there is loose connective tissue and interstitial tissue like in the face, forearm, lower limbs, in these places it will spread fast. Next is clinical features. There are signs of inflammation such as redness, pain, swelling, all that is present. There is itching in the affected side, which is followed by diffuse swelling. Diffuse swelling, it occurs because of spreading of inflammatory exudate. Okay, so the skin is stretched because of accumulation of fluid. The skin is stretched and it is shiny. So later this is followed by pain, fever and toxemia. If all this is left untreated, then there is suppuration, there is sludging and ultimately gangrene formation. Coming to its management, bed rest has to be advised with the legs elevated. Elevation of the leg will reduce the edema of the leg. Then glycerin MgS for dressing has to be done. This will reduce the edema of the part by the osmotic effect. So if the patient is diabetic, diabetes has to be treated and appropriate antibiotics has to be given, such as injection crystalline penicillin 10 lakh units intramuscular or intravenous. This has to be given 6 hourly for 5 to 7 days, or cephalosporins has to be given. So if there is snake bite or scorpion bite, in that case anti-snake venom is given in case of snake bite cases. Now coming to its complications. I told you if cellulitis is left untreated, then there will be suppuration, which will result in formation of an abscess which requires drainage. So if the inflammatory exudate spreads in the facial planes, that will result in necrotizing fasciitis. Here what happens, the hemolytic streptococcus will cause necrosis of the skin and the subcutaneous tissue, which will result in necrotizing fasciitis. So this will require a deprivement and skin grafting. There will also be toxemia and septicemia and ketoacidosis in patient who has diabetes mellitus.
If you like my video, please don't forget to subscribe my channel. Thank you.